Nebraska parents and providers of the disabled and elderly are frustrated. More than 500 people participated in a virtual question and answer session this afternoon held by the Nebraska Department of Health and Human Services.
They're upset about new requirements that are in response to the state auditor's findings of fraud. That number was in the millions. Arbella Caracta has more on changes for providers and caregivers.
I can't get it.
Zoe needs her mom more than most 23-year-olds.
Okay, and now I will try next, okay?
Crystal Wieland is her mom, but she's also a paid provider to help with Zoe's everyday needs. Through Medicaid, the federal government pays Wieland to care for Zoe.
What's something that you really like to have for lunch?
For the Wielands, this eases the financial burden of taking care of their daughter.
So if we pull out a box of mac and cheese.
But the Nebraska auditor found that some are abusing the system, billing for more work than what was done. The report estimates this fraud cost the government an estimated $1.5 million last fiscal year. So DHHS agreed to make changes.
In order for Medicaid to pay claims and expend federal funds. Federal regulations mandate these visits needed to be started and ended with an approved location capture verification method.
In other words, caregivers must use a clock in and out system with a geofence around pre-approved locations, like the client's home.
There's a few spoiling the pot of the many, and that doesn't mean that the many should be punished for that.
Wieland, along with other parents and caregivers, worry the location requirement is not flexible enough.
Our clients, our children, should be able to move throughout the community to live the life they want.
She asks DHHS to reevaluate this change before it happens. On your side in Omaha, Bella Caracta, 6 News.
The changes are set to go into effect in about 2 weeks. 2 more town halls will be held outlining the new requirements and system.